Can you answer yes to the following question? Have you or a loved one ever served in the United States Army, Navy, Marine Corps, Air Force, Coast Guard, or Merchant Marines, or in the National Guard or Reserves, and ordered to active duty by the President of the United States? If you answered yes and were discharged under honorable conditions, you are a veteran. Whether you served overseas or stateside, during peacetime or a period of war, whether or not you saw or served in combat, you are a veteran. As such, you and your family may be eligible for benefits and services available specifically for veterans, including health care, vocational or educational training, and disability payments. If you yourself are not a veteran, chances are you know a veteran who could benefit from what you are about to hear. Since the birth of this nation, men and women have set aside their own personal needs to protect and safeguard the freedoms set forth by our founding fathers. If you are among the millions of men and women who have served this country, you have earned the respect and gratitude of a thankful nation. The sacrifices made in the name of freedom are countless, especially by those who have worn the uniform. In recognition of those sacrifices, we are determined to ensure that you know about the benefits and services available to you and your family through the U.S. Department of Veterans Affairs, or VA for short, the New York State Department of Labor, and the New York State Division of Veterans Affairs. Unfortunately, these benefits are often underutilized because of a lack of information and awareness of their availability. Because we care about your needs after service, we want to make sure you are kept well informed. So sit back and in the next few minutes, learn about just some of the benefits you and your family may be entitled to. Regardless of what branch of service you were in, there are many challenges you may face after being discharged, even if you left the military years ago. For this reason, it's important that veterans, like yourself, know about all the benefits and services you are entitled to, such as health care, compensation and pension benefits, educational opportunities, employment and training assistance, counseling services, substance abuse programs, and much, much more. At this point, you may be wondering, does it matter when I served? And what if I wasn't in combat? Would I still qualify for veteran benefits?
Anybody who served on regular active duty in the Army, Navy, Marine Corps, Air Force, Coast Guard, and in some cases the Merchant Marine would qualify. But also Reserve and National Guard who have been called to active duty by the President of the United States. They would qualify as veterans for most benefits. Anybody who has served on active duty, even if they was only a very short time, male, female, in combat or not in combat, outside the country or just stateside, if for instance somebody was in the Reserve or the National Guard, they typically, unless they have been activated by the President, they don't qualify. But if they became sick or disabled while they were in training, by all means come in and see our folks.
In the mid-1990s, the VA completely overhauled its healthcare system, placing greater emphasis on quality care and service delivery. With its numerous hospitals and clinics, the VA now outpaces private sector providers in both service delivery and patient satisfaction. In fact, the VA is now recognized as offering the best medical care in the country. This is based on a broad spectrum of measures, from treating minor health concerns to caring for the terminally ill.
Well, since the VA is a national program, our veterans can go to any VA facility in the country. As a matter of fact, there's over 1,400 VA facilities nationwide.
Approximately 1990, I believe, there was a change within the VA system itself. We became a new VA. With that new VA philosophy is that there was modernization within our technology.
We have extensive diagnostic laboratory equipment. We have computerized tomography, MRIs, and PET scanning, just to name a few. VA also provides a domiciliary program that provides residential rehabilitation and treatment services to homeless veterans who may be in the need of mental health care, medical care, substance abuse, or maintenance health care.
My family goes back to basically the Civil War. You know, my father was in World War I. My two brothers were in World War II. My one brother was in Korea, and I was in Vietnam. The VA to me back then was something for people that were weird and strange and psych patients maybe. You didn't go there because there was nothing wrong with you. I just drank to take away the pain and the misery. Walking the streets, how did I get here? How did I get this far down in my life? When I came to the VA, everybody in the staff was waiting for me. They didn't have to take care of me. They didn't have to help me, but they did because they wanted to, not because they had to. They gave me back my respect. They gave me back my honor. To me, it's come around 180 degrees. I mean, I'm helping vets now, and the VA has taught me that there's other roads to travel besides drinking. Like I said, I have a job back. A vet is a vet, period, you know, and you're entitled to these benefits. You've earned them. They're yours to use. How you use them is up to you. The point is that whether you're a male vet or a woman vet, you know, use the benefits because they're there for you, you know, and they were there for me.
A uniform benefits package is provided to all our enrolled veterans. Some services that are included but not limited to are inpatient services, preventive care services, primary care services, long-term care, dental benefits, non-VA care. The myth is that veterans would have to serve in combat to be eligible for VA health care or have a service-related disability. That is totally not true. Any veteran who has an honorable discharge, male or female, is eligible for VA health care services. Women veterans are eligible for the same services as our male veterans. The VA does provide gender-specific services for our female veterans.
One of the things that I think we're very proud of is that we have assigned a women's health coordinator for each of the medical centers, and their responsibility is to really look at what the women need from that medical center and get them those services that they need, such as mammography, gynecological services, as well as sexual trauma services if they need it. So this person has been put in places to manage their care. We engage our patients at time of admission to discuss what they want, what they need, what their expectations are. We encourage all our veterans to use the opportunity of the medical centers to see what benefits are available to them. They need to sit down with our counselors. They are available to speak to, and they need to look in what is available to them. And Medicaid, like we said, is a supplement.
Matter of fact, Medicaid may be able to help veterans with transportation to and from the VA medical center for their VA appointments. The veterans should contact a Medicaid worker for more information.
I think we learned from Vietnam that when our vets came back that they didn't have point of contact, and we have taken that lesson very strongly, and we have made sure that there is a point of contact at each of our medical centers to make sure that they get the medical care that they deserve, to make sure that they've been assessed appropriately so that we can look for what their future needs are. It is a new system. It is a new VA.
The VA's healthcare system has made monumental advances in technology, patient care, and accountability. Now let's discuss other entitlements that you may qualify for. There are many benefits available through the Veterans Benefits Administration, such as education and training, dependent and survivor, home loan guarantee, and burial benefits. Some of these, such as disability compensation and pension benefits, could result in an increase in your household's income. Did you know that veterans who suffer from an injury, illness, or disease that was incurred or aggravated while on active duty may be eligible for service-connected compensation payments? In many instances, even if the condition isn't diagnosed until many years later. For instance, Veterans exposed to Agent Orange while serving in Vietnam may develop type 2 diabetes many years after initial exposure. In fact, the VA has determined that type 2 diabetes is among 10 other conditions, including prostate cancer, Hodgkin's disease, and non-Hodgkin's lymphoma, presumed to be service-connected as a result of exposure to Agent Orange. Service-connected compensation payments are based upon the severity of a condition. A qualifying disability could be rated anywhere from 0% to 100%. Payments begin at the 10% level. As of 2007, payments range from $115 for a 10% rating to $2,471 per month for a disability rated at 100%. Additional benefits are provided for spouses and dependent children of veterans with a disability rated at 30% and higher. What's more, these benefits are tax-free and adjusted annually. It's also important to note that you could receive a monthly benefit if you were a wartime veteran with limited income and you were permanently and totally disabled or at least 65 years old. These payments are referred to as disability pension benefits or non-service connected benefits. In other words, even if a disability occurred after separation from service, you may be eligible to receive non-service connected pension benefits. It's worth noting that the amount of this monthly benefit is higher than Supplemental Security Income, SSI payments. Therefore, for those veterans currently in receipt of SSI, it would be to their advantage to pursue eligibility for this VA entitlement. In today's highly competitive labor market, veterans have a supportive partner in finding and securing a job through the New York State Department of Labor. Each local office assists veterans who are unemployed, underemployed, displaced, or perhaps just transitioning from service. Veterans looking for a job can take advantage of a number of employment assistance programs, such as career assessment, job search planning, training initiatives, resume preparation, and much more. Local employment representatives contact potential employers to advocate on behalf of veterans. If you are a veteran with a disability, you may even qualify for employment through New York State's 55B, 55C program. That's why it's beneficial for veterans seeking employment to connect with a Veterans Employment Representative. To locate one nearest you, call the Veterans Labor Helpline at 1-800-342-3358. So far, you've heard about just some of the benefits available to veterans and their families. At this point, you may be asking yourself, what do I qualify for? And how do I go about receiving benefits? We suggest you begin by contacting the New York State Division of Veterans Affairs. The division is a strong advocate for veterans, and its benefits counselors are recognized among the best in the nation, offering services to veterans and family members free of charge.
The Division of Veterans Affairs has counselors, state veteran counselors in most counties throughout the state, and we assist veterans with claims for benefits from VA, other federal agencies, the state and local governments, and also we assist the spouses and the families, dependents of veterans. Most veterans are not even remotely aware of the scope benefits available. There's just such a wide array of benefits at different levels and with different eligibility criteria that it just doesn't get out to the people well enough. So we're often the first point of information for a great many of these benefits. Even if somebody has a dishonorable discharge, they may still be eligible for some benefits, and we can also see if it can be upgraded. And that applies for dishonorable discharge, bad conduct discharge, discharge under other than honorable conditions, even a general discharge can be upgraded in some cases. So part of it is explaining to the clients just exactly what they're facing, and then preparing them for the process. Sometimes they have to go through a medical exam at VA, and they should know what's involved in that. All of our counselors, and much the same in the County Veteran Service Agency, they're all veterans, and in fact most of our folks are also disabled veterans. It is important because it means that we can empathize, sympathize with the problems they're going through. Many of us have gone through the same situation, so we're familiar with it.
A lot of veterans are not receiving benefits or services because they don't know that they are eligible. Please, don't let this happen to you. You earned them. You deserve them. They are there for you to use them. See a veteran benefits counselor today. Call 1-888-VETS-NYS. That's 1-888-838-7697 for more information, or to locate the counselor nearest you. We hope you will pursue your entitlement to the benefits and services you heard about today. Veterans have unselfishly served and sacrificed to protect the freedoms of this great nation. Now it is time to serve those who served.